Hey, it's Nabi, and I'm here today to talk about my surgery. So, if you are against plastic surgery or against anything that's not natural, get off my video, unsubscribe me, or do whatever you have to do so that you don't see me. Because me personally, if somebody feels comfortable enough to have something done, you shouldn't shame them. You shouldn't discourage them. That's just my personal feeling. So if you have a problem with plastic surgery, just get off my video and get off my account. Okay? I got saline implants, breast augmentation, of course, or known as a boob job. But the professional term for it is a breast augmentation. My surgery cost $3,200. So it's different ways you can pay for it. I was going to use care credit, but the surgery place that I went to, they didn't accept it. So you have to check with your surgery place before you apply for certain, like, I guess you call it medical loans, I guess, or something. You have to check with them before you wait till the last minute to apply for credit, because that's what I did. I ended up having to pay for it cash. So that's what you just have to take in consideration when you're thinking about having this surgery done, paying for it, for one. I went to Dr. Llorente. His name is Orlando Llorente. He's in Miami, Florida. My surgery was on February the 20th. It is now the 28th, so I am a week and 1 day post-op. So when I show you my boobs, you'll be able to see how they look after a week. Prior to my surgery, I had to have blood work done. So I had to go to LabCorp and get my blood drawn for I think 5 or 6 tests, I believe, that they needed to run through me or something to make sure I'm okay. I also had to get an EKG test. So be mindful. Those things are very expensive when you don't have insurance. Me personally, I don't have health insurance, so everything throughout this medical journey, I paid for with my money. So it gets expensive, I'm trying to tell you. So save your money and don't try to just jump up and do this. My EKG test was supposed to be $200, but I went to the hospital to get it done, and I only had to pay a $50 deposit. I haven't received the bill in the mail, so I really don't know how much it costs. But I know my LabCorp bill, that was $217. So just keep that in consideration. So far, I've spent roughly $3,470. That's how much I spent so far. I got a 480 cc's in both of my breasts. I asked for 450, but I mean, I guess he thought that 480 looked better or something. I'm not really sure. Clearly I couldn't make any decisions once I was asleep, so. But that's what I got. I got 480 cc's in both implants. How the procedure works, you have the 3 choices, I believe. No, 4 choices. You can get it through your belly button, through your nipple, which is when they cut your nipple, under your breast, and you can get it in your armpit. I only had 2 options, and it was through the nipple or either under my breast. And I'm guessing my coordinator didn't tell him that I wanted the under the breast cut, because I woke up and my nipples was cut up. So I mean, that's just how that happened. But as far as how the procedure went, I got there on Monday, which was the 19th. I had my pre-op appointment. What did I have to do? I went in there, filled out paperwork. She let me try on implants in the surgical bar that they give you after the surgery. And I tried on a 420 and a 450. And I told her I wanted 450 because it looked like it was going to be a good size for me for the rest of my life. Just in case I ever gain weight, or if I stay this size, I'll be okay with that size breast. The 420 was a little too small for me, so I went with the 450. And after I filled out my paperwork, I paid the rest of my deposit. I mean, the rest for the rest of the surgery. And then I left and I went out to eat. I came back. Well, actually, I woke up the next morning and then I went jet skiing right before I got my surgery. So I had to get off the jet skis early, rush back to the house I was staying at, and take a shower. Mind you, before you get the surgery done, they want you to be freshly clean. So that means fresh out the shower, no lotion, no perfume, no Vaseline, no baby oil, none of that. no perfume, nothing. You can only put on deodorant, and that's it. And come as you are. I had to wear they asked me to wear a robe, but for some reason, every store I went to, like Target and Walmart, none of those places had like the grandma robes. And I know they didn't have no roses in Miami. I didn't even try to look for one, but I didn't even think to look for one because I didn't think they would have a rose down there. So I even went to Marshall's and I couldn't find a robe in Marshall's. So I just ended up buying this cardigan out of Walmart. And I also bought these bras zip up in the front. I'm gonna show you a picture of them because I don't think I have one in here. I really don't. But as far as what I had on a cardigan, a tank top, sweatpants. They told me to bring some comfortable socks, and that's all I had on. And I had to put my hair in a bun. I had braids when I had my surgery. So I'm arriving at 3 o'clock for my surgery, and I sat in there for about 30 minutes. And I was like, are y'all ready for me? Because y'all swear he was ready for me. Y'all was rushing me. So I'm like, is he ready? And then she's like, oh, he'll be ready in about 45 minutes. So they called me back at like 4:15, almost 4:30. And I go back in the back, undress, put my stuff in the cubby. They made me put on this paper gown. I was in my underwear only. They made me put on this paper gown. It was the most uncomfortable thing ever. They gave me a blanket and gave me a hairnet. Gave me these compression leg socks things. It was like an open toe sock or something. I don't even know what they were for. But I took them off as soon as I got home. I think you're supposed to keep them on, but I took them off because I didn't see the point of keeping them on. Clearly, I think I'm a doctor and I know everything. So I just do what I want to do. But I sat in the little waiting area with the other patients that were waiting for surgery for about 40 minutes, 30, 40 minutes, and waited for my doctor to come draw on me. They drew lines like under my breasts and down my sternum, I guess, to make sure everything was aligned properly. And I was sitting there for about another 20 minutes, and the anesthesiologist came to ask me a few questions about my health and make sure I was, you know, in good standing to have anesthesia. He said I was fine. And I forgot to ask him about my fingernails because the coordinator told me that I could not have fingernails on my index fingers or polish at all because they needed my finger to give my heartbeat or something, on my heart rate. And I was like, I just got my EKG done. She took my heart rate on my finger with these nails on. So what are you talking about? But I let her have it. I bit the nail off because I forgot to ask the anesthesiologist. So as he comes back to get me, probably like 30 minutes later, at this point, it's still light outside. So it had to have been like barely 5 o'clock. He came to get me, and I went to the back. They laid me on the table. They like strap you to the table. Like they strap your legs to the table. They strap your arms to the table, I believe. And you lay out on the table like this. And this hurts to do this. But you lay out on the table like this on your back. And they numb your arm to... They numb your arm because the needle they actually stick in your arm that I think they connect the IV to, like they put the IV through your veins through that needle. It's very big, so they had to numb my arm so that I wouldn't feel them sticking the needle in my arm. So yeah, that was, he did it twice. I told him that my left arm is weaker than my right, but he went on ahead and did my left arm because that's the side he was on. He said, oh, I should have listened to you. Yeah, you should have, because now I gotta get stuck 4 times, like, you dumbass. So after he stuck me in that last time and got me good, he was like, okay, you're gonna get a little lightheaded in 30 seconds. Man, I don't even remember thinking a second after that. I was asleep, gone. Like, I think I know what death feel like now. You just, it ain't even like sleep because I wasn't dreaming. I didn't dream about anything. I just was like blank. So that shit was scary. I mean, it was scary, but it was like kind of scary because, you know, normally you dream. I didn't dream. My mind was just like blank, like nothing. So when I wake up, it's dark outside. Mind you, it's like 8:30 when I wake up. So they was like, oh, this procedure's been done, but you didn't wake up. I was like, I didn't wake up. They said, yeah, you took a little while to wake up. So they said we knew you were still alive because you were breathing, but you just didn't wake up, like, you know, like that. After we took you off the anesthesia, you woke up like, you know, 30 minutes later. So I was like, oh, okay, near-death experience. No, I'm just playing. Just kidding, y'all. I'm just playing. I ain't trying to scare y'all. I'm just playing. I'm just trying to make some comedy out of this. But yeah, so that's how that went. They wheeled me out of there. What else happened? They wheeled me out of there. I don't even remember. I remember being in a wheelchair in the hospital or like in the surgery building, but I do not remember getting in the car. So, yo, when I wake up from after being put in the car like 20 minutes later, I'm at 7-Eleven. I'm like, where the fuck am I at? I could have sworn I was at the doctor's office. So I'm like, at this point, I thought I got kidnapped. Whole time, my boyfriend and his my boyfriend came and got me, and he met his friend and flew out there to meet him at 7-Eleven. And I'm like, the fuck is going on? Why am I not at home yet? Like, they playing. And I'm like, y'all playing and I need my medicine at this point. Now you ready to make me mad. And so that's how all of that went. And Miami does not have a lot of 24-hour pharmacies. It took us like 20 minutes to find a 24-hour pharmacy. And then when we got there, they didn't even have my Percocets. So I was hot. Okay? Okay. So I got my boobs done because me personally, everybody in my family has boobs, even my younger siblings, female siblings, and I'm about to be 20 and ain't got none yet, so I didn't think they was coming because everybody else had boobs since they was like 13, and I was stuffing my bra and wearing double bras at 13 and 12. So at that point, I was just like, this is my only move. And they want to say, oh, wait till you have kids, they'll grow. Oh, okay. Yeah, I'm not gonna be basing my life off having kids. I just rather pay this $3,000 or $3,500 and just give me some implants, just like that. Okay. I wasn't really in pain. It's not painful. It's more of it's like it's not comfortable. Like you're very just not comfortable. For one, you have to sleep on your back for 7 to 10 days. That was problem number one. I don't sleep on my back. I sleep on my stomach and my side. So me having to sleep on my back with a pillow right under my butt, like basically arching my back, and then I slept on the couch, first of all. That was more comfortable than sleeping in a bed to me. That's how you know the sleep that you have, the way you have to sleep is very uncomfortable. You rather sleep on the couch than to sleep in a bed. So that was, you know, it wasn't painful. Now, if your boobs are bigger than mine, or, you know, bigger than, or you have more skin, it's less tight. Like, your skin is not as tight as, you know, it would be for somebody going from an A cup to a D cup. Like, if you're going from like a C cup to a D cup, or like a B cup to a D cup, you have more of a skin to stretch. I didn't have any skin because I didn't have any boobs to start with. So, mind you, I was a 32A before I got my boobs done. I've been a 32A for forever. Never grown, like, at all. So, I don't know what size I wear now. Of course, I will update y'all the size bra that I wear when I go actually get bras. But, yeah, the pain is not really painful. It's more uncomfortable. So just keep that in mind. It's not painful. It's just uncomfortable as hell. Okay? It's still uncomfortable. So my aftercare, I have to take 4 antibiotics a day, 1 every 6 hours. I have to take 1 to 2 Percocets a day. I don't even take the Percocets anymore. I just stopped taking them because all they did was make me go to sleep, and I'm not in pain, like, at all. It's just uncomfortable, like I said. I have to antibiotics, Percocets. I couldn't wash my upper body for 48 hours, so I had to take a bath the first 2 days after my surgery. After the 3rd day, I was able to take a shower, and I still wasn't really able to, you know, you're not supposed to wet your wounds, but being that my breasts have fully, like, not fully, but they're back together and it's scabbed, I can wash, but be, you know, very gentle around it. I also have to sleep for straight up like on my back for 7 to 10 days so that the implants can heal into place, like, so that they don't move while I'm trying to heal or whatever. I'm past that, so I'm on my side now, okay? But it takes, I have to wear the sports bra or wear the bra with the zipper in the front for 3 months. But they are so uncomfortable, I swear. I guess it's supposed to be uncomfortable because it's supposed to be pushing your breasts together instead of, like, you know, you notice how when the bra is attached in the back, it's more of like to flatten it. But if it's in the front, it's more of like pulling it together to like, you know, cleavage. Like okay, so you see, for instance, I got a bra on and it's going like this. See how my boobs going backwards? If I put on the bra, it's gonna bring them together like this and keep them in place. Right or wrong? Right. So the recovery from it, like I said, I'm fine. The day after my surgery, I was on the boardwalk riding a motorized bike. So I mean, does that, I hope that's like a good, you know, like scenario as to, you know, how you should feel while riding a motorized scooter. You should like be like pain free. I wasn't painful in pain at all, like at all. And I know I wasn't supposed to be on that scooter, but I didn't care. I was in Miami and I was going to enjoy my trip that I paid for. Okay, so I'm going to show y'all my boobs. And y'all probably seen them a little bit the whole time, but now I'm going to show y'all to them for real. So, these are the boobs. And this is what they look like from the side. Don't mind my armpit. This is the other side. See, this implant is more under my arm than the other one is. I'm not really sure why, but of course I would have to go find out what's going on with that. Let me show you. I don't have any cuts under them, so I can't really show y'all my nipple. I'm just not doing that. But it's healing pretty well. I should be back in work. I got my surgery done on the 20th, and I'm going back to work on March the 7th, so that's like 2 weeks, I think. And I feel like that's more than enough time for me to fully loosen up. That's all I'm waiting for. I'm waiting for the skin to loosen up. This is just a note from me. If you want to get this done and you just feel like nobody is going to approve of it, or nobody is going to support you, fuck it, who cares? As long as you got one person to go with you, you'll be fine, okay? You'll be fine. Don't worry about what nobody got to say about you once you get them done, and you know, and before you get them done and all that. Like, who cares? Like, so many people told me not to get this done, and guess what? I didn't care. Look, I didn't say nothing about me getting them done until after I had paid $1,500. Like, at this point, whatever you say, nothing is gonna amount to $1,500 and make me not want to get this done. So, you know, do what you want to do. Do what makes you happy. This made me happy. I'm gonna have boobs for the rest of my life. Whether they grow or not, I'm gonna already have them. So, you know, I just feel like personally, if you don't like something about yourself and it's a way to change it or a way to fix it, why not? Look, God made you a certain way, but if he knew that, you know, it could be a possibility that you was not going to be happy with the way you are, he created an alternative. And this alternative is these fucking titties. I won't happy being flat-chested. So, you know, he helped me out. And, you know, it cost me a little money, but at the same time, I'm happy now. I can wear cute, I can wear Fashion Nova. I can wear fucking Fashion Nova. Like, yeah, so I'm happy now. So, like I said, I'll leave his my doctor's Instagram, his website, and his address and phone number and everything in the description box so that you guys can check him out. He also does amazing butts. Of course, I'm not getting my butt done because I'm too bony, but he does great butts, lipo, tummy tucks, mommy makeovers, breast lifts. He does I feel like personally he does everything good. I haven't seen him do any Botox or anything like that, but in the building that I was in, it's 4 levels to it. It's the ground level, which is just the elevator. Then it's the second level, which is where you get your therapies after surgery. You also can pay your money down there. You also can pay for the rest of your surgery down there, and then they have like a facials and stuff like that. And then on the 3rd level, they have like Botox, dental stuff, and all kind of stuff. And I meant to tell y'all that you have the option to get the therapies before you go home, or you could just, like I said, like most people do, go look on YouTube and see how to massage your own breast, which is just a motion of going like this, like moving the implant up and down. That's all it is. I personally would not pay for them to do the massages. They're $100 a piece, and your breasts are really tight. Then they don't even really do the massages while recommend that you do the massage while you're there. So don't pay for them. Me personally, it saved me $400 because they wanted me to get 4 massages and I just wasn't paying for it. So that's just a reminder. Think about that when you're looking, when you're paying for stuff. Think about that. When you're looking for a doctor, look for doctors that do well on your size. Basically what you have versus what you want. Look for doctors who specialize in that, or that you see a lot in. Like, a lot of people don't know how to give flat-chested people big breasts without them looking crazy. So, you know, you have to look out for stuff like that. But you guys, I am loving my girls, and I cannot wait till the summertime because I'm going right on over to Thailand for my birthday, and I'm gonna be looking like a snicker, honey. Okay, but that's it for this video. Make sure you guys like and subscribe. I will do a month update, and then I'm going to do a 3-month update, and then I'm going to do a 6-month update. But in between, I'll be making videos about hair, makeup, and stuff like that. If you guys want me to review anything, just let me know. Of course, hey, this is YouTube. It's all about YouTube, okay? See you guys next time.